Noise-induced hearing loss or music-induced hearing loss is when the structures of the inner ear, specifically the hair cells, become damaged from sounds that are too loud or too long. Normal hearing occurs when sound enters the ear from the environment and travels to hit the eardrum and sends it into vibration. These vibrations move the structures of the middle ear and the inner ear. Within the inner ear, there are sensitive hair cells that convert the sound waves into electrical signals. These signals are then sent to the brain. The hair cells are extremely sensitive and can easily be damaged if the signal they are receiving is too loud or too long. Once these hair cells are damaged, there is nothing that can be done to repair them. Some people may even experience a temporary hearing loss after attending a concert or having some other type of exposure to loud noise. Listening to your iPod at the highest volume for only 5 minutes is enough to cause a gradual hearing loss. If listening to your iPod at the highest volume for only 5 minutes is enough to damage your hearing, imagine the damage that can be done by listening to your iPod for an hour-long car ride.
That's interesting. I didn't know that. That's very...
The consequences of noise-induced hearing loss are much more than not being able to hear your music as well. The lowest level of damage that can be caused by listening to your music too loudly or for too long is a temporary hearing loss or a ringing sensation in the ears. This can be your first sign that your music is too loud, and a permanent hearing loss may occur if you do not change your behavior. As a young adult with noise-induced hearing loss, you may have trouble in school and difficulty communicating with others. If you cannot hear and process what someone else is saying to you, how can you learn or respond correctly to a question? Hearing plays a crucial role in learning in school. Not being able to correctly hear all of the information a teacher is saying during class will affect your ability to understand the material and display your knowledge on a test. Socially, a young adult with hearing loss may have difficulty relating to their friends. You may have difficulty hearing what people are saying in noisy environments, such as the lunchroom. If you cannot hear what people are saying during conversations, how can you take part in the discussion or state your thoughts? Fortunately, there are ways to preserve your hearing and keep your ears working properly. Now we are going to discuss the different types of headphones that you can buy and which ones are best for your ears.
There are many types of headphones on the market these days, and it is important to consider how they affect your hearing when making a purchase. iPods and other Apple products come with white in-the-ear earbuds. These headphones fit in the ear canal and send the music directly toward the eardrum. There are other options to use when listening to your Apple products or any other personal media players. In-the-ear earphones are placed in the ear canal and fit comfortably. They create a tight seal in the ear canal. Another option is an over-the-ear headphone, which fits comfortably over your ears, rather than being inserted into the ear canal. Over-the-ear headphones can be noise-canceling or not. Noise-canceling headphones reduce the presence of outside noise when listening to music in noisy environments. We all have experienced a moment when background noise was just too loud to hear the music we are listening to. What do? We turn up the volume to drown out that background noise. Some headphones are better than others to keep the background noise out and music in. Let's investigate the difference between these headphone styles and background noise. Our volunteers will listen to music using several headphones and no noise, low levels of background noise, and high levels of background noise. First, our first participant will use the in-the-ear earphones, and our second participant will use the iPod earbuds. We will have you both listen to the same song in no noise and select the volume of which you prefer to listen to music. Okay, you can start. Okay, and now we will measure these listening levels. be participant too. Yeah, that way. Now let's see what happens when we introduce some background noise. Select your preferred listening levels when listening to music. And now we will do the same thing with high levels of background noise. Listen to the same song and choose your preferred listening level. You can begin now. Okay. Now let's measure our results. We will repeat this procedure using all headphones that I introduced.
Right.
Okay. Now with a little bit of background noise. And now with high background noise. First, no noise. Now some noise, please. And now high noise. No noise. Now some background noise. And some high background noise.
see from our test, the listeners had to turn their music up even louder when using all of the headphones besides the over-the-ear noise-canceling headphones. This is dangerous since these headphone types project sounds very close to the eardrums and therefore have a greater ability to cause damage to the ear structures. We know this damage can be prevented by using over-the-ear headphones, especially over-the-ear noise-canceling headphones. What are some other ways we can prevent noise-induced hearing loss?
Don't turn the volume so high on your headphones.
That is correct. You should cap your volume at 50% of the maximum capability when music is being listened to all day. Music can be increased to 80% of maximum capability, but only for about 90 minutes without causing damage. Some other tips and reminders to help prevent noise-induced hearing loss. Use speakers when possible. Listen to your music in environments with minimal background noise. To determine whether or not your volume is too loud when you are listening to music, have someone stand 3 feet away from you and ask them if they can hear your music. If they can, it is too loud. An iPod at full volume is nearly as loud as a chainsaw and can cause damage within 5 minutes of use, so remember that. And lastly, remember, over-the-ear noise-canceling headphones are best to maintain healthy hearing.